Hello, so today I'm going to be making another video on administration of oral medications. Here's my patient for today. He's on my couch in my basement, so I'm going to pretend that's the patient's bed. Here is the water that I'm going to be giving my patient, and here are the two medications. I'm going to be administering 500 milligrams of acetaminophen and 100 milligrams of Docuzate, and then there's my laptop for charting and such. Excuse me. Sorry about that. Okay, so the first thing I'm going to do is check the MAR, and then I'm going to check my patient's allergies. I'm going to look for any reasons I could be withholding the medication. I'm going to check their NPO status. Obviously, if I'm administering anything PO, I want to make sure that they can actually swallow. I want to see if they have any swallowing problems or fluid restrictions because I'm going to be giving him water to help him drink. For planning, I want to gather my equipment. I've got my laptop. I've got the tray. I'm going to pretend this little table here is the tray. I've got my medication cups with the medication, and I've got the water, and it is appropriate. I checked he can have water, and he can swallow perfectly fine. So I'm going to go to my med cart. I'm going to perform my hand hygiene, so I would pretend I'm washing my hands, and as you can see, I'm in uniform. I forgot, I want to make that clear. I'm in my uniform, so I would use my hand sanitizer and wash my hands, which I don't have right now. I'm going to state the 6 rights of medication, so right medication, right route, right dose, right time, right documentation, and right patient. And then I'm going to do my first check. I'm going to read the MAR. I'm going to check the expiration date on both medications, make sure that it is not expired. I'm going to compare the MAR to the label on the medication container. This will be my second check. I'm going to calculate the correct amount of drugs to be given. And as I mentioned before, I'm going to be giving 500 milligrams of acetaminophen and 100 milligrams of Docuzate today. Next, I'm going to place the floor stock and liquid medications in separate cups. So you can see I already did that just in case the patient decides they don't want to take one of the medications. It's best to place them in separate cups. Next, I'm going to pour the liquid medication if I have any. These are pills, so I'm just going to place them in each cup. The next thing that I'm going to do is I'm going to do my third check for the medication. So I'm going to check the labels again on the medication and compare it to the MAR. This is the third check. Next, I'm going to carry it to the patient's room. So I would put these 2 medications in the water on the tray. And then upon entering the patient's room, I would knock. I would enter the patient's room. I would address myself. Hi, Terry. This is George. I'm going to be your nurse for today. So I identify myself. I perform hand hygiene. So I want to wash my hands before I touch anything when I enter the room. I want to identify the patient. So I'm going to look at the patient's wristband. I want to make sure that it's them. I'm then going to ask him for his name and date of birth, and Terry was able to give me that just fine. I asked Terry if he has any allergies, and Terry says, no, I do not have any allergies. Next, I'm going to pull the curtains. So pretend I'm closing the curtains to give the patient privacy. I'll be giving Terry privacy, and I'm going to explain to Terry that I'm going to be giving him his medication. He receives his acetaminophen every 4 hours PO, and he receives the Docuzate 2 times daily PO, so I'm going to be administering both of those right now. I'm going to ask Terry, do you have any questions? Terry does not have any questions. He knows what's going on. Next, I'm going to use the remote to raise the bed to a comfortable working height, so I do that. I raise the bed to a comfortable working height. Next, I'm going to check the apical heart rate and the pulse and assess the pain. So I would use my blood pressure cuff Or actually, I could just use the I could just listen to the pulse and listen to it for a full minute. The apical pulse. It sounds good. I'm gonna ask Terry if he's in any pain. He is not. And then I can also do the blood pressure, and blood pressure is normal. Then I'm gonna look at the medication given and the dose, and like I mentioned before, 500 milligrams of acetaminophen and 100 milligrams of Docuzate. So that's the medication that I'm going to be giving. Now I want to position Terry up. You do not want him flat. So I'm going to raise the bed and get Terry sitting upright. I want him upright while he's drinking and taking his medication. So Terry is now sitting upright. Next, I'm going to scan the patient's wristband. I'm going to scan it. I would scan the medication. And I'm going to compare medications to the MAR. This is the third and final check. And the medication is correct. I look at the dose, the time, the route, and I could record any data like the pulse, his pain scale, and the heart rate that I listen to. Now, when I administer the medications, I'm going to offer water, so that's why I have the glass of water here to help Terry swallow his pills. I'm going to ask Terry his preference, how he wants to swallow the pills. He says he wants to take them all at once and swallow them, so he does that. And then obviously I have to record any intake and output if necessary. And I remain with Terry. I want to make sure he actually takes his medication before I leave the room. And he does. He's a good patient. He swallows his pills. He has no problem. Prior to leaving, I'm going to use the remote. I'm going to lower his bed back to the lowest possible height. I'm going to raise the rails to keep him safe. And I'm going to give him the call light to make sure he can call me if he needs help. And I will perform hand hygiene before leaving the room. And I'm going to verbalize to Terry, so I'm going to let Terry know. Terry, I'm going to follow up with you. If you need any help, if you have any questions, I'll be back to check up on you. Just let me know if you need help. And that wraps up my video for medication administration orally. Thank you.